Welcome back into Everyday Kentucky. We're here with Dr. Austin Stone, who's here at the UK Sports Medicine, Orthopedic, and Surgery Center. Doctor, let's see, I'm going from memory here. So you work with athletes at UK, EKU, Lexington Sporting Club. Did I miss anything?
No, you got it.
Wow, that's a lot. How do you manage your time?
Very carefully. I rely heavily on my digital calendar and my team, so it is busy. We do have University of Kentucky athletes. We have the men's and women's sporting teams at the Lexington Sporting Club, so it's a great honor and privilege to take care of those professional athletes.
Absolutely. Let's talk about what you do and what you see. There have been, every time I come over here, I love to talk about the fact, and people don't realize it, there have been so many advances in what you guys do orthopedically. There are some people that not all that long ago wouldn't have a surgery because they weren't confident in it, and now the outcomes are just so much better.
Yeah, I think that's a testament to the research and advances in the field. And I think what's really important about being cutting edge is that you participate in those activities.
True.
And so we have a great group here, and we've launched several research studies treating very common injuries such as ACL tears, injuries of the ligaments of the knee, meniscus injuries, and patellar instability. And so we have clinical studies there that are really investigating these and bringing state-of-the-art techniques to University of Kentucky.
And for people that don't realize this, I'm old enough to still know people that had knee surgery. It immediately ended their career. They've got these big zippers on the side of their knee, and it has really affected their functionality for a lifetime. But what exactly is it that you're looking at with these new studies?
Well, I think surgical techniques are really important, and so being thought leaders in the area, not only of how to do the operation, but then how to rehabilitate that operation is really critical. So some of our studies are looking at what happens after the injury and how do you go through the rehabilitation process, while others are actually how do you prevent some of the bad stuff that follows the surgery. And so post-traumatic arthritis is something that happens after both meniscus injuries and ACL injuries at an alarmingly high rate. That'll end a career. It'll also mean a knee replacement at an early age. And so a couple of the studies that we're looking at are treating the potential mediators of post-traumatic arthritis in the knee. And so there's a few studies involving the ACL reconstruction and then also meniscus injuries.
And is that the way you reconstruct when you go in there and do these studies, or
well, I
materials you use, or
not so much materials, but medications can help.
Gotcha.
Especially on the back end, and we have a couple of studies. I'm very excited to say they're multi-center studies. They're working with Harvard and the Cleveland Clinic and University of California. So we are really global leaders here at the University of Kentucky and partners with those other institutions.
That's all. It must be really exciting to be a part of that and to be one of those doctors and be at a place where you're out on the front end, and before it becomes widely known, you're able to help people with these advances.
Absolutely, and I think it's great because as participants in these studies, many of these actually even pay the participants, so they're getting cutting edge technology and being paid to do so. Absolutely.
Thanks, Dr. Stone. We appreciate everything you do.
Thank you.
Thanks for being with us here on Everyday Kentucky. For more information, all you have to do is go to ukhealthcare.com/ortho.